This is CBS 6 News in high definition.
Affording Healthcare, a program in the works to save you money. We get answers on when it's going to be available and who's eligible.
Making health care more accessible, states are now working to create exchange programs under the Federal Affordable Care Act. New York isn't quite there yet, and when it is, what will that program look like? Well, fact finder Matt Markham went to get some answers today. And what'd you find out, Matt?
Hi, good evening, Liz. There will be credits made available in October to make health care affordable for a large number of people in the Capital District, 1.5 million across the whole state of New York. Those who make the lowest incomes, though, will get the most credits. Open enrollment is about to begin in 6 months, and between then and now, there's a lot of coordinating going on behind something designed to look and work easy.
A lot of data that has to move between the state and the federal government, various agencies in the federal government, between the state and the health plans.
CDPHP is keeping its finger on the pulse of health care reform. The Affordable Care Act requires New York to set up its own insurance exchanges where you can select the plan that's right for you. New York's isn't finalized yet, but will likely offer two options.
The individual exchange is for people who are uninsured, whose employer doesn't offer health insurance, or people who work for a large employer whose health insurance is either unaffordable or doesn't meet minimum standards.
You'll be able to enroll in October. New York's plan has to be given a clean bill of health by then.
Then there will be a second exchange that will be for small businesses. That's businesses less than 50 full-time employees.
New York State received a $185 million grant in February to aid with the development and technology for its exchange.
An individual will go into the computer site, will input various information about themselves, including their income, and that will in turn tell them what they're eligible for and give them some comparisons on what type of health plans they could obtain.
While the exchange takes effect in January 2014, it may grow into another form after that.
We need to be flexible. We need to learn from what's not working and quickly change that so that the exchange continues to go forward and works.
You have to meet the right eligibility requirements to receive credits for the healthcare exchange. I'll explain what they are at 6 o'clock, Liz.
You know, Matt, this idea of this healthcare exchange may be new to us here in New York. We knew it was coming. We still don't really have it yet. But Berkshire County already does have it. And I'm wondering, is the New York plan going to be similar to that?
Well, it could be, Liz, because Mass's plan is regarded as the national model for healthcare reform altogether. The exchange there is about 7 years old now, and 98% of all the residents there in the whole state are insured. I actually went on their website today to try it out, poke around, and see how easy it is to use. It's kind of user-friendly, but it is a little bit confusing, and that is one concern about New York's program as well. So they're going to pick and choose what they like and maybe what they don't like, Liz.
All right. I think there's probably a fair amount of confusion all the way around about how this reform will affect each and every one of us. But over time, I'm sure the answers will come, and we thank you for the ones you gave us today.
Thank you.
All right.